So central PA. So I want to be nice on top of them. So you really want to try to keep this hand as relaxed as possible. Having your other hand on top. And then I'm using kind of my hypothenar close to my pisiform as my mobilizing. And I'm going to use my body. So I'm nice and relaxed, kind of right on top of her. And I'm doing a central PA. So I'm doing a central passive accessory movement straight down.
With the unilateral PA, one of the things that you can use for how do you find where the facet joints are. So I'm going to take my thumb and it's going to be just lateral to the spinous process. At that point, I know that I'm on the segments that I need to be on. So for a unilateral PA, I'm on the facet joint and I'm going unilateral. In this particular demonstration, this would be a UPA on the right of L5S1.
Half bolster or a towel is rolled and placed underneath the patient. And this allows the spine to side bend, opening more toward the top. The therapist is on the side facing the patient and interlocks their arm between the patient's, slightly contacting the patient with the body. The fingers go on the underside of the spinous process, with the forearm contacting the hip and the forearm contacting the patient's body. And the motion is an entire body motion of this type motion. Fingers contacting the undersurface of the spinous process. The goal is opening or gapping the top side of the spine.
Hey guys, so in this video we're going to go through a lumbar rotation technique to improve lumbar spine pain. This one obviously would be you pivot, you get the person into the same position where your foot is hooked into the knee crease. I'm going to rotate the arm as well, okay? Then have the hands in this position here, come through. And what I've got is I've blocked the spinous process closest to me above with my thumb, and I've just hooked my fingers around the spinous process below on that level, and then I just rotate. And I'm using the thumbs and fingers more as a guide. Most of my rotation is happening through the slight drop of my left side and my forearm onto the ilium on this right hand side. And this would be used for a right-sided problem. So it's the top side that you're going to be getting more stretch on, and people will feel it generally on that side, okay?
Lumbar self-snag using a belt extension. Place the strap at the indicated spinal level. Ensure that the belt rests between the arms and the body. The patient flexes the elbows and experiences a lifting or gliding sensation. If not, shorten the belt and try again. It is imperative to teach patients the correct glide angle, which in the mid-lumbar spine matches the vertical plane of the facet. Instruct the patient to pull up at the indicated glide angle. Have the patient extend the trunk. Facilitate proper movement during the initial extension and subsequent repetitions as necessary. The glide must be pain-free and sustained during movement.